Hi, I'm Dr. Kristen Kinsevich, Assistant Professor at Evangel University and Licensed Professional Counselor. We are in Module 6 of the Supervisor Training Series, and we're in the second video where we're talking about formative evaluation of the student. So, formative evaluation, of course, is a process of formation. We're evaluating as the student is progressing and forming, which is different than summative evaluation. We'll talk about that in the next video. And that's kind of when we evaluate them at the end of a semester. So here we're talking about the ongoing process of evaluating a student and giving them feedback as they are growing and progressing. So we're going to talk about using goal setting with regular check-ins on how those goals are going. Talking about providing direct feedback in the moment. This is what your supervision sessions are supposed to be for. And so, how do you go about that? We'll talk about the challenge of pointing out blind spots to your student or supervisee and talk about using encouragement rather than praise. So, first, let's talk about goal setting with regular check ins. It's so important that your supervision sessions are consistent, that they should be a minimum of 45 minutes in a row, not 10 minutes here, 20 minutes there. And I think we kind of all talked for an hour throughout this week, but really you're sitting down and having a full supervision session between 45 minutes and 60 minutes. And it's intentional, it's planned, it's consistent, and that gives you the chance to regularly check in on the students' goals. And so, first of all, we have to write down our goals if we're going to have them. Sometimes the student paperwork at the beginning of the semester provides a way to do that. And so you can kind of build on that. But the student and you should be writing down or having each a copy of the specific goals that the student has for that semester. And this is within the first couple of sessions in supervision, just like we would with a client. It's a supervisee driven process. Again, just like we would with a client, we're not making goals for them, but we're helping understand what are the ways that they want to grow. What are the specific skills they want to focus on working on? Are there certain treatment modalities they really want to become familiar with? That kind of thing. And then it's important to clarify the specific means by which those goals will be worked on. If they want to gain skills in a specific kind of treatment area, well, then are they going to read some things on that? Are they going to specifically get direct kind of role play experience with you in supervision to practice those techniques, that kind of thing? Of course, we want to revise if needed. So if the goals or the means to accomplish those goals aren't working, then let's continually revise them and make sure that it's an ongoing process. Or if they accomplish that, maybe at the beginning of the semester, they thought, maybe I'm not that great at establishing rapport, but they find out they really are excellent at that. And maybe they need to challenge themselves in a different area. So again, we want to be consistent with those check-ins. We do not want supervision on the fly, crossing paths in the hallway, but sitting down and actually having them check in. And even maybe, okay, the last week of every month, we will specifically talk about how your goals are progressing, something like that. And we recognize this is the process of formation. And so again, the formative evaluation actually is what helps the student form. And so without it, they don't really have feedback on how they're doing, how they're progressing. And so they're kind of just guessing as to whether or not they're growing. But if it's a regular check-in, then they can see the progress they're making and they have specific steps to take in the next week, in the next month to work on those goals. And so we want to pay attention to the developmental stage of the supervisee and use that formative evaluation to foster growth. So, what developmental tasks are they working on that they need to accomplish? That was listed in one of the earlier videos when we talked about record keeping. The spreadsheet system that I described has some of those developmental tasks listed. It also has some skills listed. So even those are great ways to say, hey, if we don't know, how to set a goal or what you really want to work on, pick from those lists, and that can be really helpful. So providing direct feedback in the moment is really important. We want to, again, avoid it coming across like advice giving or you're doing it wrong, but observations of what the student is reporting to you, and even observing what they're not reporting to you, which I think we talk about in a different module. But it's important to be specific. Use a concrete example of the supervisee's actions, whether that's in a recorded or a live observation of a session, or whether that's based on a report they're telling you. You should also have access to their progress notes and be reviewing at least some of those. And so you can kind of see, okay, how are the progress notes sounding and how does that match what they're coming in and telling me? And I can point out specific examples. I can also give them specific examples from my own experience. Students really learn a lot from our own clinical stories. And so while we don't want to make the whole supervision hour about us, it is helpful to kind of use self-disclosure just the way that you might with a client when it's appropriate. I think it's great to be creative. Again, we talked about this in module 3, but kind of using role play to provide them with feedback as well. It's a very hands-on, experiential kind of way to give feedback. And invite the supervisee to share any feedback that they might have for themselves. Hey, if you were watching you, or maybe you did just watch you in the role play or in a recorded session, what feedback would you give yourself? Um, Using your supervision hour wisely is important. So you need to kind of develop a rhythm for your supervision session so that there's enough time to give feedback. If they're spending 45 minutes just kind of reporting on each client to you, more of a case management style, which we talked about, I think, in module 3, then it's really, you're not going to actually be doing a formative process. You're just going to be case managing. And so we want supervision to be something that, you might spend the whole 45 minutes just on one piece of a session and really working it through, doing some role plays, giving some specific feedback. And I think if you recognize a way that the supervisee could grow specifically this week, okay, you know what? It sounds like you were a little anxious when you thought about broaching, such and such a topic with this client. What if you try to broach that this week with a goal of observing what arises in yourself when you do it? Notice the anxiety. What's that about? Something like that is very specific and very useful for the supervisee to say, okay, I know that when I'm going into session with this particular client, here's what I'm keeping in mind. Some of my supervisees, what I've done is said, okay, notice that you tend towards being a very goal oriented therapist, which is great. But also, this particular client may need you to hold back a little bit and be a little more person centered. Why don't you practice person centered techniques this week with this specific client? And so it's very tangible, very doable for them. And then they can see, again, what arose in them when they tried to do that, what made it hard, what felt good about trying a different method, that kind of thing. And really maybe keep it to one per session. If you tell them 5 different ways to grow this week, then obviously that's overwhelming. It's too much. It makes them feel that they're not doing a good job. So don't offer so much feedback in one week that they can't really implement the change. And then also, you don't have to give them the homework all the time. Just like with clients, we can say, okay, here's been our supervision session. We got to the end of it. What's your big takeaway for this week? What's something you want to do differently with just 1 or 2 clients this week? And let them just determine kind of what steps they're going to take. Now, it can be challenging to point out blind spots for your supervisees. It can be uncomfortable, but it's important for us to broach those topics and help them to see what they're missing. And so, of course, number 1 is observe. What patterns are you seeing in them? What issues might they be overlooking in their supervision session? Again, noticing what aren't they telling you in supervision? Maybe something you picked up from a progress note that they really didn't come in and report, or gee, every time they come into supervision, they just talk about all the wins from their sessions. So, okay, were there any struggles this week? Oh no, I'm great. They may be trying to impress you, or the opposite. Oh, I really, floundered this week. I don't know what I'm doing. Okay, there may be some imposter syndrome, and we need to really talk about that in the developmental ways that shows up in counselor development. Of course, we want to be gentle. Think of Gottman, right? The gentle startup. When we are giving constructive feedback, especially if we think someone is blind to it, we want to use gentle words and say, hey, would you mind if I pointed something out to you that I think actually you might not be seeing in yourself? That's just verbal consent right there. Are you open to me sharing that with you? Most of the time, supervisees are very eager for that, actually. And they say, oh, yes, please tell me that. Or if they're having a really horrible day and they just, you know what, I just found out that my grandmother died. Could we do that the next session? Certainly that can help to just get that in the moment consent. and give them time to process. If you're saying, okay, we've met for 45 minutes, it's minute 50 now, I just need to give you some hard feedback real quick and then we'll end. Again, just like a session with a client, you wouldn't want to save it for the end. So you might want to bring it up kind of towards the beginning or the middle. If you observe something and you're not really sure how to say it in that supervision session, then save it for the next one and start with that. Hey, before we dive in this week, would you mind if I shared something with you that I observed last week, and I wanted to give myself time to think about it before bringing it to you, but I really like for us to talk about it, something like that. From the beginning of your supervisory relationship, set the expectation that feedback is part of the process so that they're not surprised or think it's a criticism from you or that it's unusual for you to give them feedback or point out areas they may not see. Talk about the growth process and learning and ways that it's very normal and natural for them to miss things, and that you're going to be observing and looking for those things so that you can help them grow. And then if you are modeling teachability and non-defensiveness, then that helps them to behave that way as well. So that's all about that supervisory relationship, having that rapport so that they trust you when you have to speak into some difficult areas. And then finally, be clear. It's really difficult to hear feedback when someone's beating around the bush or kind of hinting, or they might totally miss the point of what you're saying. And so if you have some specific examples, hey, I've noticed that over this, we're 6 weeks into the semester. I've noticed every time you come into supervision, you bring me just the cases where you're feeling really great. Maybe, let's spend the next 3 weeks just talking about the cases where you're feeling unsure. Maybe that would help bring up some of the challenges that you're facing. Or have you noticed that you seem to be bringing me kind of the ones that you feel good about? Why do you think that might be? Again, open-ended questions, giving them the benefit of the doubt, not being harsh with them, but really having an open conversation. And then using encouragement rather than praise. I think we hear this in like parenting models and things like that. Praise is things like, oh, you're doing a great job. You're a rock star, best intern I've ever had, right? Nothing else that I would suggest you do differently. You're totally on track. To me, I think this is the lazy way to do supervision because we don't have to think too hard. And it can be difficult when we do have students that are really doing well. So with those students where, they have the basic helping skills, they're establishing rapport well with their clients are making progress, all of that is great. Hopefully they're going to be a better clinician in 10 years from now than they are right now. So they're not in an ending place if they're in supervision. So are there some more challenging therapeutic techniques that they could try, or some evidence-based protocols they could get trained in? Really look for ways that they can improve, because it's actually harmful for a student to hear that they're a rock star and that there's nothing else they can do to be better. That's actually discouraging because it makes them feel like there's nothing else for them to learn, or it could be kind of falsely patting their ego in a way that's not helpful either. Encouragement is things like, when you leaned in that recording and your body language, actually your posture changed, I could see that the client really felt that you were connecting right there. I'm taking a moment from a recorded session and I'm pointing it out to them so they see what they're doing in themselves, and it's encouraging. Or, when you use that intervention, that showed a lot of creativity and good clinical judgment. What are some ways you can really capitalize on that? And, think of maybe the client that's the hardest for you. What if you were creative with them as well? What would that be like to kind of use that strength? So again, praise communicates that the supervisee doesn't need to grow, or that it communicates you have nothing to teach them, which maybe undermines your position as a supervisor as well. And it creates an overconfident novice, which we don't want going out into the field. But encouragement balances with constructive feedback. It shows that you're paying attention to them, that you're investing in them specifically, that you care. And it gives the supervisee ideas on what they can try again in the future, because you're seeing, oh, hey, that worked, try that again. And so that can be really helpful feedback as well. All right, we have one more video in this module, and I will see you then. Thanks for watching.